This is Dateline Sunday, November 1st, 1998. Tonight.
Everybody knows the worst thing you ever want to hear is the word cancer.
This deadly type of cancer strikes 50,000 Americans each year. It killed Jacqueline Kennedy Onassis. But now there could be a breakthrough in treating non-Hodgkin's lymphoma.
Is it a magic bullet for lymphoma?
It's getting close.
Bob Bazell on a new cancer fighter that's giving cancer patients a fighting new chance. Still ahead, it may seem like medical magic. A new treatment for one type of cancer that works with breathtaking speed.
When did you start to notice a change in your tumor?
The next day.
The very next day.
Could this be the answer to curing her form of cancer?
Perhaps you heard the news this past week about the powerful cancer-fighting drug tamoxifen. For years, it's been used to treat women with breast cancer. And now it's been approved as a way to actually help prevent the disease in healthy women at high risk of getting it. It's a breakthrough you first saw here on Dateline last spring. Well, you're about to see another. A new drug to treat a different type of cancer in a very different way. Doctors say it can work in just one dose to restore health and hope without crippling side effects. Here's NBC's chief science correspondent, Robert Bazell.
Kevin Billow is hoping for a miracle. He lives in a small town in Michigan where his life centers around the family he adores, his wife Kathy and their 3 young children. Kevin, a 38-year-old postman, was always healthy until he discovered a small lump on the top of his leg a year and a half ago.
The worst thing you ever want to hear is the word cancer.
A trip to the doctor confirmed his worst fear. Kevin was diagnosed with an almost always fatal kind of cancer, advanced low-grade non-Hodgkin's lymphoma, a cancer of the immune system which can appear almost anywhere in the body and make it difficult for white blood cells to fight disease. It is the same cancer that killed Jackie Kennedy Onassis in 1994 and strikes more than 50,000 Americans a year.
It changed our life completely.
Kevin's prognosis was grim. He says doctors told him he might live as long as 15 years, or as little as 2.
Good throw, Cole, man.
Devastating news for a young father, and heartbreaking for his family as well.
Daddy! Daddy!
Every day I look at them, I think, you know, I've got to fight this as much as I can.
As much as he wanted to fight, there were few options. Conventional treatments, including chemotherapy and radiation, at best bring a remission, which is often temporary, and the treatments can make patients very sick. But Kevin got a new choice. Doctors suggested he enroll in experimental trials of a new medicine called Bexxar, which was showing promising results. Is it a magic bullet for lymphoma?
It's getting close. One large one.
Dr. Mark Kaminsky headed the team that developed the new drug at the University of Michigan Cancer Center in Ann Arbor, and he co-owns the patent.
It's like a homing mechanism. These antibodies are smart. They know exactly where to go.
It is a piece of biotechnological wizardry, an antibody attached to radioactive iodine. Together, they seek out the cancer and destroy it.
These antibodies, which are like guided missiles that can recognize exactly where the tumor cells are, and when they're finally concentrated in the tumor site, radiation starts working on the tumor cells.
You're talking about a treatment that you give in a short time, has many fewer side effects than chemotherapy, and seems in many cases to work a lot better. Is that too good to be true?
I hope it isn't.
Kevin Billow and his family hope it isn't too good to be true either. Patients like Kevin get the medicine in 2 separate intravenous injections that in the future could be given in a few hours on an outpatient basis.
Love you, baby.
Because of the potential for harm from the radiation, Kevin was kept behind lead shields in isolation for a few days. He wouldn't be able to see his children for a week. This was the hardest part for his family, who wanted to be by his side.
We'll be back, Daddy.
How many patients in your latest experiments are helped by this treatment?
Basically, the vast majority are helped.
Teresa Singh, a 40-year-old mother of 2, is living proof of just how effective Bexxar can be. A lump in her abdomen, big enough to be seen through her clothes, turned out to be a case of low-grade non-Hodgkin's lymphoma.
I cried, of course, and all I could do was picture my hair falling out because I knew cancer meant chemotherapy.
But what happened next, Teresa says, was nothing short of amazing.
When did you start to notice a change in your tumor?
The next day.
The very next day?
Yeah.
What happened?
While I was in the hospital bed, I didn't see any lump there at all, and I was amazed.
A CAT scan proved that Teresa's tumor hadn't just changed appearances from the outside.
That whole thing right there is her tumor. I calculate this to be the size of a cantaloupe. And this is now her CAT scan, and you can see in the same location that it's all clear.
There's no tumor in here at all?
There isn't any shred of tumor.
So what happened to that tumor? It just disappeared?
It basically resolved. It was taken care of by the immune system.
You mean it's gone?
It's gone.
A cantaloupe-sized tumor disappeared?
Right. What's amazing is that just took one treatment.
In fact, Dr. Kaminsky says so far, 100% of previously untreated patients see their tumors shrink when given Bexxar, with 71% having a complete remission, a higher rate than conventional treatment. And since Bexxar seeks out only cancer cells, not healthy cells, it does not cause the usual side effects of chemotherapy and radiation. Teresa has now been in complete remission from her advanced lymphoma for more than 18 months, never having chemotherapy, radiation, or even feeling sick. She says her only side effect from the treatment was a temporary low blood count and an underactive thyroid, which is easily treated with a replacement hormone.
Is this the beginning of a new age of cancer treatment, this drug?
I hope so. We've really pushed the limits as to where we can take a patient with toxic therapy.
Unfortunately, what Bexxar can't do is help patients with other kinds of cancer. It only treats non-Hodgkin's lymphoma. But could it be the long-awaited cure for this fatal disease? Dr. Kaminsky says it's just too soon to tell. But some of his patients no longer show even the smallest signs of cancer in their bone marrow with the most sophisticated DNA tests. These are results any cancer patient would be happy to hear.
We have to have a word of caution here. We're going to need longer follow-up and find out whether that test really means cure. And it's going to take years for us to figure that out.
Well, Kevin Billow did have a common side effect from Bexxar, flu-like symptoms that lasted a couple days. He was stunned by the remarkable change he saw in his tumor soon after his treatment.
I had a lump in my groin area. It was about the size of a ping pong ball. And the day after the treatment, I could barely feel it. Gonna be easy on me?
No.
No!
He's back on his feet and waiting for the next round of tests to determine if his cancer is really gone.
My hope is complete remission, and my hope is that it can help others too.
We'll be right back.
You're watching NBC.